Influenza is a viral illness, and most of us call it the flu. But there's not just the flu, it's multiple viruses, multiple strains. And so that's one reason why you have to get a flu shot every year. It's spread by, most of the time when people cough, even if you can't see them, you kind of have micro droplets. And either you cough right into, unfortunately, somebody close sitting next to you, or they might cough on a table surface, say, and then you touch that with your hand, you rub your eye or touch your mouth, you end up getting the flu. It is very contagious, and usually within 1 to 4 days you start showing signs. The average is about 2 days. And the thing about the contagiousness of it is that you usually are contagious 1 day before you actually have symptoms. You of course are contagious for the whole time that you have fever, and that usually is anywhere from 5 to 7 days. Symptoms include things like runny nose, cough. I'm sounding like a cold, right? But runny nose, cough, fever that can get up to 103, 104, aches, body aches. You can usually tell, for me as a pediatrician, I can tell when a child has the flu almost by how they look when I go in there and they're curled up in a ball on the table. And the mom tells me he has 103 fever. If you haven't gotten your flu vaccine and gotten the prevention, you're going to have fever for probably 4 to 7 days. Anybody's at risk for it, but the high-risk people are going to be your elderly, your younger people, and pregnant women. Flu is terrible for pregnant women. So they really, if you're anticipating getting pregnant during the flu season or that you'll be pregnant during flu season, you want to be covered with the flu vaccine. So anybody greater than 6 months of age who the doctor has said you deserve a flu vaccine. Usually if you're allergic to eggs, we kind of walk a thin line there, but you want to talk to your doctor about that. But pregnant women, people who think they're going to get pregnant during the flu season, any child greater than 6, and especially your elderly people, because it's more devastating illness for the older and the younger and the pregnant woman. It's pretty easy to diagnose in that we do a flu swab, we take the symptoms, the history, and then we do a flu swab of your nose, which is a Q-tip in your nose. And in about 15 to 20 minutes, we can tell you if you have one of the strains like A or B. There are multiple strains, and so we may not be able to tell you that you have the flu, but we can go with the history of it. But when we can tell you you have the flu, we usually can do that in 15 to 20 minutes. A lot of people think, oh, well, just give me that antiviral medicine and you're treating me. You've got to understand that it has its own side effects. A lot of our people quit taking the antiviral medicine because it makes them nauseated, and you're already a little bit nauseated when you have the flu. So, and it doesn't really cure you of the flu, it simply shortens the course by about a day. And you have to have gotten right in and get diagnosed and then get on the antiviral, because it's only good if you start that antiviral in the first 48 hours. So ends up, most of the time, treatment is simply rest, fluids, and acetaminophen more than ibuprofen. But you always are going to want to do that, and then I start over again and say rest, fluids, and because that's going to be the best thing. Usually, generally, somewhere around October, you start seeing cases all the way through, say, April. There's a big peak usually around the February month. December, January, February, March are going to be your biggest months, but February can be a big spike. And it's an important thing when you know the season is you want to get your flu vaccine at least 30 days before the flu season hits. So that means you really want to get it like September. We always say the fall, but September. And we here at the Baton Rouge Clinic start getting our vaccine in somewhere at the end of August, and then we'll have a flu clinic for any of our patients. Whole families will come and everybody gets the vaccine together. If you are getting your first flu vaccine under age 8, you're going to need 2 of them to have full immunity. And when I say full immunity, there's something that everybody should remember. The flu vaccine is not an exact science, because we try to guess, I say we, it's really the CDC, Centers for Disease Control. They try to figure out what viruses are coming around the world and what was in the country that we'll get next, kind of thing. And that's how they decide what virus strains are in the vaccine. It's usually 2 of the A strain and 2 of the B strain. And if they miss one, then it's only going to be about 75% accurate. But honestly, because of the way it's spread, you can still get the flu even though you got the vaccine, but we have noticed that the people who get the flu who had the vaccine seem to do a lot better, less sick with it. So it's not an exact science, but it's absolutely still worth getting the flu vaccine. We have a flu clinic here at the Baton Rouge Clinic. What we do for our patients to try to help them save time and make it quick, we have a flu clinic and we usually have to change that around where we have open space in the clinic. So you hit the front door, there'll be a sign that says, go to the flu clinic here. It's for all ages who are qualified for the flu vaccine, who are patients here. It goes faster if you're a patient here because we already have your chart. They simply have you wait for a few seconds, they pull up your chart, figure out that you're qualified for the vaccine, they give it to you, and you're back on your way, back to work or school. And we will announce that. We usually do that through My Chart. We'll send out e-blast and that sort of thing, as well as anytime if you don't have a My Chart account, you can simply call us. We do allow other people to get the flu vaccine at our clinic. We try to figure out about cost and that sort of thing at the